So this video is going to show you how to remove a drain. I'm going to start by emptying the drain, and I've already checked my doctor's orders. So I've emptied the drain. I'm going to check the drainage here. It's 50 cc's and it's zero sanguineous drainage. Okay. I made sure that I am not re-engaging the suction as I am going to be taking out the drain now. And I am ready. Okay, so like I said, I haven't closed this, but you can close it here, but not re-engage the negative pressure of the drain. When I took this normal saline out of the supply room, I had already done my first check of normal saline. It's not expired. I'm gonna do my second check here, so it's normal saline that I'm gonna use for cleaning the wound bed. It's not expired, expires March 2025. It hasn't been opened, and now I'm going to pour it. Okay, checking again, normal saline for drain, cleaning the around the drain, and it's not expired. And shaking off the dressing here using an alcohol swab using the walk-off technique. Okay, looking for any drainage that's dry and intact. Okay, 180, look at it, it's dry, it's clean. 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 And once more, which makes it a total of 6 times. I also can see that it's still wet, so I have to dry it around the site. Okay. Looks dry here. It's cleaned. I'm assessing around the wound site here now. Just looking for any sort of redness, you know, Ureta. Is there any inflammation? I can see the suture is intact. There's no drainage. There's no signs and symptoms of infection right now. Okay, so I'm ready. I have my scissors and I am going to cut the suture. Something to keep in mind right now is that I know that I'm going to be taking out the drain, so PPE would be a good idea with a face shield, so because there can be splashback when you're removing the drain. So I'm cutting as close to the skin as possible here. It's intact. Getting rid of it. I technically don't need these anymore, so I could get rid of them, but I'm going to put them in my sharps after. And now I'm ready. Gonna get my 4x4 ready here. So Mrs. Smith, I should have explained to you here that now I'm going to be removing the dressing. Removing your drain. So please try to look the other way if you can. You're gonna feel a pulling or tugging sensation when I'm doing this. And that could be quite normal. For that to happen, okay? So I'm just gonna get ready here now, and okay, so I'm gonna place this here so it's ready for me. Okay, on the count of 3, I'm gonna take the drain out. I want you to take a deep breath, and when you're exhaling, I'm gonna remove it. 1, 2, 3. Before this, I'm applying some counter pressure here. You can see I'm not touching what's going to go over top of the wound here. So again, sorry, Mrs. Smith, on the count of 3, 1, 2, 3, take a deep breath in and out. Okay, keep going, in and out, keep breathing, keep breathing. Okay, I'm going to leave that there. Making sure that the tip is intact here. This is going to go into the biohazardous drain. Bin, afterwards. Lift this up. Okay, there's no drainage, that's great. And we're done. So I will dispose of, again, the drain in the biohazardous bin. I'm going to get rid of my forceps in the sharps container and get rid of my garbage.